Alright. Jennifer got the first thing on video, and now I've gotten all the rest of them, so just remind me and we'll get them on Facebook tonight. Risers.
Somebody grab about two or three more pillows and put pillowcases on. It's my slow walking, just dragging for girls.
It's like a Trendelenburg bed.
So lay on your, we'll do the lingula first. So lay on your right side, that way you can face down and I can see.
Lingula.
Although I'm gonna have to get in front of them, so can you get up there?
Yes.
Alright guys, so we're going to do the lingula first. So the lingula is in the left lobe of the lung, right? And it's kind of lays in the same anatomical position as the middle lobe. Alright. So you would have to, in order to do this side, you would have to have her lay on her right side to do the left lung. She is going to be 30 degrees head down. Okay, again, we don't have fancy tables, the hospital beds in the hospital. You can put, remember how we showed you to do Trendelenburg? You can do that in the hospital bed. These tables do not. Okay, from this, she needs to be a quarter turn from supine. So which way am I going to roll her?
Slightly that way.
Slightly which way?
Slightly that way.
Towards me?
Yes.
Okay, sounds good. So who got the extra pillows?
And just a quick question. When we're doing the practical, since obviously we don't know if this is exactly 30, do you want us just to state I'm putting them at 30 degrees?
Yes, I will ask you.
Okay.
I mean, if you put them in head down and you don't say 30 degrees, I'll be like, what degrees is their table at? And I'll say it real quick, and then.
So even though we're using these, we'll just state what it actually is. Okay.
And then in hospitals, you'll have a bed rail to put up. And since I don't want Kwanda to fall out of bed, who wants to come be my bed rail?
I can because I'm. Oh, go ahead. I was gonna say I'm videoing it.
Brian's gonna make sure you don't fall out of bed.
Brian.
If she falls out of bed, that's your grade.
You got
Okay. Oh, and actually, you know what? I can be the bed rail. I forgot. I was gonna say I need to be in front of her, but when I bring her back, I can see her face. Sorry, that's the next one. So here, where am I going to percuss? Don't look at your sheet. Think about where we said the lingula was. Where is it anatomically? Tell me actual landmarks.
Midline of the axillary.
Okay, it is midline to axillary. What level?
Is it a 4th?
4 through 6. So 4 through 6. Where does the 4th rib usually lie?
Underneath the sternum.
Right through the nipple line, right?
Oh, that's right.
So you want to go right underneath the breast tissue, okay? And if it's a female, I usually have them cup their breast tissue and pull it over to the side for me. So if you'll go ahead and cup your tissue and bring it over. Sorry. Although, you're like, oh, good. So, anyway, and then you go right below the breast tissue. Now, if you're percussing way back,
I'm sorry.
like if you're percussing way back here, then that's not right. It ends mid-axillary, so it should be more anterior, right? And right underneath the breast tissue, okay? Once I've got her positioned, I'll use the other 2 pillows. So if you can hand me the other 2 pillows, because I'm the bed rail too. And here, you position one in between her knees. And I'll give her one to hug if that makes her feel good, better. You feeling okay? Everything feel good?
Yep.
Okay, if any time during this treatment, what did I do first before I even put her here? Teach her how to cough. Okay. So here I'm going to percuss. See how much easier it is here? You can use 2 hands if you want to. How long? 3 to 5 minutes. And then I have her breathe in and out.
So would
And
you
I can
have
do a
us
quick
do them
stretch
cup
at the end. Did you see how I did that? Quick
Mhm.
stretch. So, need to work on my timing.
No,
But
that's good.
so vibrate down 5 to 7 times. You can do a quick stretch at the end to get more expansion. So if she's not expanding when she breathes, so say she was breathing in and out, and I went down, she's not. Quick stretch, breathe into my hand, breathe into my hand. You can even add a little bit of resistance. So you can do lateral costal expansion or segmental expansion by having her breathe into your hands and push out when she's inhaling. When she exhales, you're going to add vibration, and then right before she inhales, you can give inhale. Right before she will inhale, you can do a quick stretch. Okay, and then that will allow more expansion too. So quick stretch, breathe into my hand. Whatever the person needs, that's what you'll do. Okay, it depends on the patient. Any questions about that?
Did you say that you would give them a sputum cup as well?
Yes,
And a towel?
and a towel.
I'm just thinking about practical and real life purposes.
That's fine. And
Okay.
we have cases that we'll practice. After we're done with this, we have cases, and all of them pretty much have a postural drainage position that you'll have to go through with your patient. So that's when you'll bring in, make sure you have the towel. So people are always like, how do you get them to cough here? So say, you know, I did my percussion, I did my vibration, she's ready to cough. If any time before the end of the treatment she needs to cough, she just needs to tell me, I'll stop what I'm doing, she can cough. Okay. From here, what you're going to do is you're going to have them come up on their elbow. Okay, and you may have to help them up. They will cough, and you may have to help hold the sputum cup. Okay, if you are having to help a lot with the cup and wiping and with the mouth after they're done, make sure you put on a pair of gloves. Okay. Because they're head down too, so it makes it difficult. And then you'll help guide them back down to their sideline, and then make sure too that you're rolling them back into you. Okay, so it's got to be that quarter turn. Okay, it can't be straight sideline. Any questions? So the other one, the middle lobe, is what? No, middle lobe is on the what side? It's on the right side. So it's the exact opposite of the lingula. It's the exact opposite. Same position, 30 degrees head down, quarter turn from supine. You will percuss right inferior to the breast tissue and more anterior. Okay, and here I can see your face. Okay, so you can even stand behind your patient like this, and just that's it.
So you just flip her that way, do the exact same thing on the other side.
Pretty much.
Okay.
So really, you're just putting her on her side, placing the pillow, and then just having
Having
it back,
her-
and just state what it would
Yeah.
be. 30 degrees from supine.
Well, it's a quarter turn.
Quarter
It's a
turn.
quarter turn from supine.
Okay.
It's 30 degrees head down. 30 degrees Trendelenburg.
Okay.
Quarter turn from supine. Okay. I mean, you may be able to start them from supine and have them roll, put the pillow, and then have them come back. That's fine. However they're laying in the bed, I mean, that's where you're starting from when you get them. Okay. All right. We're feeling okay? No dizziness?
Nope.
All right.
Let's go.
All right. So go ahead and go practice.